let me encourage each and every one of you. If you have not yet gotten out to register to vote, you have until Monday to get registered to vote in this unique time we're living in. So I want you to do that and make sure you vote. Now, what's going on? What's going on? What's bothering everybody? Recently, we lost this brother, hero gone too soon, colon cancer. The beauty of his process is that he knew 4 years ago, but never did so. And he was a wonderful inspiration for men and women, not only of color, just men and women, period, who are dealing with colon issues, stomach issues, and you might not have the right information. You might not know what to do. Chadwick, what a crusader. So I brought that up today because we have a very special guest on, our good friend, Dr. Kevin Marks, who is a help me, Doc, is a gastrologist. There you go.
Gastroenterology.
Yeah, what he said, that word. But the truth of the matter is we walk around with these proteins, enzymes, parasites, things floating through our system, and we're really not aware of how severe some of them can be. Am I correct on that?
That is correct. Thank you, Larry, for having me and for inviting me to talk about this very important subject that I'm very passionate about. Just to tell you a little bit about myself. I was just going to say that, I am a native of Louisiana. I'm a graduate of Xavier University in New Orleans and a graduate of Meharry Medical College, where I received my MD degree. I trained here in Houston at Baylor College of Medicine, where I became trained in both an internal medicine specialist as well as a gastroenterology specialist. And I've been practicing gastroenterology in Houston since 2006, mainly situated in a west side corridor of Houston, particularly in Katy.
And for everyone who's joining us today, we have a special nugget I'll get to a little later on, because we really want you to enjoy this segment and learn and call the doc, ask as many questions, because growing up in the 60s, Doc, we didn't talk about stuff like this. We didn't even know what it was. You had a stomach ache, you took some Pepto-Bismol, and that was that. But can you walk us through just how easily people can have colon cancer and not know it?
Absolutely. And so when we start talking about, what are the symptoms of colon cancer? One of the most common symptoms is no symptom at all. So a large percentage of patients don't even have any symptoms that prompt them to go to the doctor. It's often, and that's the scary part about that, is when you don't have symptoms, you're not worried about it. And unless you're doing other things to be proactive to check to see if you have it, then it goes undetected. And that's when things get to a point where medicine may not be able to treat it effectively.
So you wouldn't know by having a loose stool or constipation or severe pains, anything like that?
So, the thing about it is those are such commonplace symptoms that they, of course, I don't want people to walk away saying that that's an indicator that you have colorectal cancer. But certainly any change in your regular frequency, your regular bowel habits is a tip-off. If that change occurs abruptly and if it persists, that could be loose stools, it could be constipation. Right. The one that we all think that we have to see for there to be colon cancer is bleeding. Bleeding is certainly alarming, but it's not the only symptom. If you have something as subtle as a change in the caliber or the shape of your stool, that could be a subtle indicator that you have to pay attention to.
So Doc, I want to make sure I get back to stress levels, COVID-19. There's a lot going on in our world, but I brought Chadwick. I brought this. I keep this at my house because I just thought this was an instrumental. His passing at 38, but then to learn he had colon cancer was just mind blowing. What can you share about what you've learned about his process?
So what I know is that at the time of his death, he was actually 43, but he got diagnosed around age 38. From what I read, it was around 2016. I believe shortly after they shot Black Panther. And when he was diagnosed, it was stage 4 at the time of diagnosis. Now, what I can tell you is that the teaching is that on average, to go from not having colon cancer to developing a polyp, to that polyp growing and becoming cancerous, it's about an average of 10-year process. So if you subtract 10 years from Chadwick's initial time of diagnosis of stage 4 colon cancer, it leads us to conclude that he probably first started developing the process at the age of 28, possibly.
So not being would a physical, could you find that, or would you have to have a colonoscopy to know for sure?
Well, a physical, meaning meeting with your primary care doctor, doing blood work, having them examine you, take a history, that physical can provide what we call tip-offs of something more serious going on. It could be on your blood panel, you could be anemic, and not just anemic, but your iron levels can be low. That can be a subtle tip-off that you're losing blood from somewhere, and that somewhere could be from your colon. And so certainly a physical exam is definitely a good place to start, especially if you're having symptoms.
Yeah, it's unique. I had my last colonoscopy, I believe it's been 4 years ago, and that was it was a great process because it led to some other things that I wasn't aware of. It wasn't my colon, or I had no polyps. Mine was related to a blood pressure problem. It was high going in. They lowered me to take the test and another multitude of things. But I'm glad I did it because it answered another question that I was personally dealing with. So my plea is today for everyone watching, with all the stress that's mounting on us with the pandemic, trying to take care of our kids, ourselves, our moms, our dads, you got to cut some time out for yourself and get tested.
Absolutely.
What are some of the what's the biggest resistance you get, Doc, from people when you, or like we're doing now, doing our best to encourage to get the word out? What's the biggest pushback? Is it insurance? Is it cost? Is it, I don't believe it, I don't have the time?
It's actually, I wish I could say it's just one reason, but different populations of people have different experiences. So certainly there are those of us, even in our community, in the African American community, access to healthcare, to affordable healthcare is an issue. And there are people who really want to get it done, but the costs become so prohibitive if they were paying for this out of pocket. That's certainly one. But then there are those who embrace urban myths about whether or not the rectum is enter or exit only, etc. And that in itself, as silly as it sounds, is a reason why, in particular, us guys, many guys don't get their colons checked the way they should. Now, certainly, for some people, it's just due to lack of understanding. And that's what we're here for today, is to try to better educate and identify other reasons that could encourage someone to get this done. And some people just are not in the habit of going to have annual checkups with their doctors, because if they do that, if they have a good doctor, their doctor is going to be on them about getting this done. Their primary doctor will.
Yeah, I've had several discussions with guys, especially during Prostate Cancer Awareness Month. You have to. I mean, Black men die from prostate cancer more than any race on the planet. You just have to. And with that comes getting your colonoscopy and several other things. But if you love life, you've got aspirations to become a Dr. Marks, let's say, and own your own practice and do the good in the community that you were blessed to do. In this season, you really have probably the right amount of time to take the time to go in.
Yeah.
Let's knock down this fear of being scared or it doesn't, yeah, that happened to him, it won't happen to me. Well, you don't know. You don't know. You haven't been to the doctor in 10, 15 years. You don't even know what your blood pressure is right now. So I encourage people, we spend a lot of time encouraging each other. We talk about owning our own businesses and this seminar and that seminar. And you need to invest in your health because your health is your wealth as far as I'm concerned.
That's right.
And, you're a native of Louisiana and you know the fine cuisine. I married a young lady out of Lafayette, so I know the culture very well.
There you go.
And this is what we preach. I don't want to get too emotional because it's a big deal to me that folk take time to visit people like you and your business, especially when you're dealing with my radio station and for years we've been about the community, about putting you in touch with the very best of the best folk that we would take our family members to. I've taken my family members to, and I want you to just get encouraged by what we're going to offer you today. But I wanted to lean back on two half thoughts. One, stress, does that play into any of this? And two, diet.
Absolutely both. The way that stress plays a role in this, and not just in colorectal cancer, but in many conditions, including other cancers, stress has the ability to put a hand on your immune system, right? So stress can lower your resistance to fight off things, right? And our immune system plays a pivotal role in the prevention of cancer. If we all didn't have immune systems, we would start having cancer probably in the first month of life. But our immune system is like that quality control person working. I'm gonna go back to my Louisiana ties. They had a bunch of fruit of the loom plants there where they made a lot of underwear and things, right? And so there was always a quality control inspector making sure and there was a commercial Fruit of the Loom used to advertise like that, or Hanes. And if they don't say Hanes, if I don't say Hanes, they don't say Hanes, she would say. So your immune system plays the role of being that guard keeper to make sure that all the cells that are coming through are legitimate and that they are healthy cells. Now, when we have breakdowns in our immune system, that's when things can go awry, and cancer is one of those things that is a end product of that process. As far as diet, absolutely, Larry. Going back to our early days, you are what you eat, from your head down to your feet. Remember that. Right. And so, our diet is one of the primary contributing factors to another major risk factor of cancer, and that is our weight. Our obesity and developing things like diabetes are directly related to our diet and activity levels. And then other behaviors, whether we smoke, do we drink alcohol excessively, and then what is our family history? What's our risk factor from a genetic standpoint? And the only way you're really going to know that is if families talk to one another. And historically, colon cancer was not something, as you said, that families typically talked about, but we got to do a better job at passing that information on to our loved ones.
So, Doc, we opened the show with a bit of a nugget for those who are watching today. And we actually have a chance for you and a couple of your best friends to join us at a sold-out comedy show that's coming up on the 10th of October with 4 headliners. Ricky Smiley, Marcus D. Wiley, Ali Sadiq, and Juan Villarreal. But they have to got to do a little work to get these tickets because these are very, very special tickets. And they need to go by your site and or visit myhoustonmagic.com and fill out some information. And you can pick up a couple of pair of passes to help laugh, which today we could all use a good laugh from somebody. So,
Amen.
we'll remind you about that on the end. So, Doc, you interned at Baylor or Mahara in Nashville?
I went to medical school and got my, I guess, basic medical training at Meharry Medical College, but I did my intern residency and gastroenterology training here at Baylor College of Medicine in the Houston Medical Center. Yes. Phenomenal institution.
Okay. What would lead a brother in that path? What nugget said, you know what, I have an interest? Was it a family issue or just curiosity? I mean, the backstory is always fascinating when I find, successful folk like you who have a great practice giving back to the community. I want to know what light bulb went off and said, I can do this.
Good question. For me, I became a pharmacist. That was my undergraduate degree from Xavier.
Okay.
And I was, at the age of 23, I was working in corporate America. I was working in the pharmaceutical industry. And meetings, the stress level kicked up. I personally started experiencing acid reflux. And as I started learning more about it, I found it to be quite fascinating. Concurrently, around that same time, my mom started having a lot of gastrointestinal issues, and I got to know her gastroenterologist, who was just such a gentle giant, and he was such an amazing clinician, and he further helped shape my interest in gastroenterology. But the nice thing about gastroenterology is every day is different. There's no such thing as a routine because you never know what you're going to get, as far as Gump says. I could be dealing with, a 27-year-old with colon cancer, or I could be dealing with a 65 or 70-year-old with just diverticulosis or diverticulitis. It's a lot of things that goes on from the moment we eat food to the time we eliminate it. There's a lot of processing that has to take place, and things can go wrong anywhere along that processing.
Right. It's a deep dive for me, and I applaud you because we've had, as we progress into this new age of my new youth, there are unique things that are beginning to happen, and heartburn is something that I never really experienced, but I'm getting now. I can't eat as much spicy food as I, used to, and it's an amazing process as the body just does what it does. You're still thinking you're 47, and here you are 67, and you can't possibly handle that stuff. And you need to get tested. I can't scream it loud enough from the top of 24 Greenway Plaza. This is so important, especially for men and women, correct? I mean, everyone needs to get checked.
Absolutely. And that's one of those urban myths that, there's some guys who think that this only affects women. And of course, there are some women who think it only affects guys. But the truth of the matter is, in the United States, it's a 50-50 deal. That's one area where it's definitely 50-50. The one area where it's not necessarily exactly 50-50 is that men who get colon cancer die more frequently than the women who get colon cancer. And it's probably nothing to do with the biology. It's more to do with how proactive you are and how soon you get detected, how early you get detected.
Two questions, Doc. Is there a particular age that you should start getting tested for colon cancer? I know for prostate cancer, we recommend it for men at the age of 40. Is there a number?
Yeah, the new number that has been recently endorsed by the American Cancer Society is 45.
Okay.
It used to be 50 and it stayed 50 since the 1990s, but they've lowered it to 45. That process initially started back in 2005 when the American College of Gastroenterology went on a bold limb and suggested that we start screening African Americans in particular at age 45. That never really took off very well until 2018 when the American Cancer Society said everybody needs to start getting screened at age 45. And if you have a family history or other risk factors, that age can even be sooner. If you have a family history, a strong family history, then you can get screened even sooner than 45.
So, Doc, we go in for a colonoscopy and you find some polyps.
Mhm.
What happens then?
So a polyp is usually the earliest phase or the earliest step in the development of colorectal cancer. In most instances, at the polyp stage, it's benign, it's not yet cancer. And it represents an overgrowth of tissue that just grows out of control. So during a colonoscopy, yeah, we're looking to see if you have cancer or a tumor. But most importantly, we're looking for polyps because that's how we are able to prevent colorectal cancer. It's by the removal, the detection,
Hmm.
as well as removal of polyps. And that all takes place at the same time during that colonoscopy. So the colonoscopy not only becomes diagnostic, it's also therapeutic and preventative.
All right. Someone wanted to ask on Facebook exactly what is colorectal cancer? Exactly.
Yeah. So it's a cancer that originates either in the colon or the rectum. Now, technically, the rectum is kind of part of the colon, but it represents the lower 6 centimeters of your large intestine that before stuff empties into your anus and into the commode. So rectal cancer is kind of treated the same as things that are higher up. But it usually starts out as a benign growth of tissue known as a polyp, as mentioned, and it usually grows eventually into this large mass of cancer cells. And colon cancer, colorectal cancer, has 4 stages: stage 1, 2, 3, and 4. The lower stages are better than the higher stages. Stage 1 and 2 are usually confined to the wall of the colon and usually curable just through resection, whereas stages 3 and 4 imply that there is more advanced disease with spreading to some of the adjacent lymph nodes and to the other organs. You've heard of metastatic colon cancer. That's when the cancer has left the gate, left the colon, and spread to other organs such as the liver, the lungs, or the brain. And that's where Chadwick was at the time of diagnosis. He was
Yeah.
stage 4.
So, Doc, man, you had a great thought I wanted to capitalize on. Someone wants to know about red meats play
Yeah.
a factor. Now, we kind of discussed it a little earlier, but red meat in specific as
So
opposed to.
there's definitely, it's not just eating. You're not going to get colon cancer just because you ate a steak. But if you're that guy or lady who eats a steak Monday, Wednesday, Saturday, Sunday, and in between you have hamburger, you're getting too
Mm,
much red meat, right? It doesn't mean you can't eat red meat, but you got to be, and that's with anything, right? Anything in excess dietarily needs to be placed into moderation. And so red meat is one of the risk factors, as well as low fiber diet. So, you know,
mm.
if you're going to eat a steak, throw in some veggies with that. That's why the steakhouses like to sell that asparagus or that steamed spinach, because they know they're trying to protect your colon. But
We were talking
certainly
earlier.
red meat is one of the dietary factors. As Go ahead, Larry.
Oh, okay, thanks, Doc. In the staging or stages of the colon cancer, how do you treat stage 1? Is that through radiation or an operation? How does that How do you get cured?
Yeah, if something is caught in stage one, it usually implies that it's really at the level of the surface of the colon and it hasn't started extending into the muscular layer of the colon. And usually, it's, depending on the size of the mass, if it's a small mass, I can remove it through the scope at the time of a colonoscopy. It's not uncommon for me to find a large colon polyp that's amenable to endoscopic removal. And we find out after removal that it had cancer in it, but the cancer hadn't spread it. Well, guess what? That's a cure at that
Right.
point. Now, as it starts getting bigger, more sizable and irregularly shaped, or even invading closer to the wall, that's when I refer a patient to the surgeon. And usually the surgeons can resect a segment of their colon. And in most instances, that in itself imparts curable status.
So we get into trouble as it goes, as it develops more, or the cells continue to multiply and do what they do.
That's right.
So you wouldn't you wouldn't purposely want to get to stage 3, would you?
No, no,
Okay. All right.
no. When you start talking stage 3, then that's when you have to start talking about chemotherapy and radiation. So you got to see a friendly oncologist at that point, for sure. Stage
Okay.
1, 2, most instances amenable to cure by resection.
I want you guys to go by Dr. Mark's site, by the way, and myhoustonmagic.com. Fill out the information so you get a chance to join us for a night of laughter. Doc will be there. We're going to have a good time. Ricky Smiley, Marcus D. Wiley just celebrated a birthday. Funniest guy on the planet in my book. Juan Villarreal and Ali Sadiq, just 4 great men of comedy. It's a good night. So do that on the site. But Doc, we had a question from a young lady who's 70 years old asking, is a colonoscopy still necessary?
Absolutely. As of now, the American Cancer Societies, they're issuing it's not etched in stone, but when should you stop screening for colonoscopy? Right now, that age is somewhere around 80. I've even seen 75, but it depends on, I've got some 70-year-old patients who are healthier than some 25-year-old patients. So I think you have to really look at the overall patient. You shouldn't just look at a person's age and say, oh, she doesn't need that. Or, or any other aspect about them. Oh, he doesn't need that. And, we 70, as long as your heart is pumping and you're able to withstand the process, I say do it. You should get it done.
Yeah, it's just for me. I'd like to know. I just need to know where I am. Do I need to reset, regroup, put something down, add something in? My family is my inspiration, and I've got some things I want to see these beautiful girls of mine do when they become of age. And I'm going to take every precaution and do as much as I need to do to get it done. So that's what we're encouraging today. Dr. Kevin Marks, Baylor, Xavier, Louisiana native, good man. How long have you been in private practice, Doc?
This is my 14th year, conclusion of my 14th year, going into my 15th year. Yeah. It's been a blessing.
You are the blessing, sir. You're the blessing to discuss this with, so many people who were shocked, one, by Chadwick's death, and then to hear that he had died of colon cancer, and then carrying it around for that long, stage 4 was just miraculous. So I take things as they are, and I see that light. It's unfortunate that his life is over, but what a great way to leave a legacy, not only on screen, but then you see the work he did at St. Jude without complaining to those kids and going through the new work that he had planned for us. So that'll be there. But to the enlightenment guys, you gotta get tested. We gotta find out about ourselves. We're out marching, we're fighting, we've got systemic racism, we've got to vote, we got to get to graduation, we got to get past this pandemic, we got some business to open. We need us. And I'm loving on us right now. And the first step is, as we started today, your health is your wealth. You're not going to be able to do anything from the grave. Nothing. Except feed the insects that get in you. That's it. You can't do nothing from the grave, boss. So I need you to call Dr. Marks, get in touch with the office, get the appointments, and, let all the myths go. Because I wouldn't be on here if I didn't know for a fact this gentleman is as good as he is and can do what he does. We wouldn't waste our time doing that. And we're not playing with you. I don't want to come off a little crass, but we're important to each other now, and we need to encourage each other to take advantage of folk who will tell you the truth. Make sure your insurance is in place. If not, we'll work something out. We just want you healthy. Am I offline, Doc? Or, I get excited about wellness and health. All right, not sure if Doc is frozen on that end or not. Away from us, trying to come back. But again, I want you guys to make sure you hit our website at myhoustonmagic.com. Look for Dr. Kevin Marks. It's a good brother, great practice, over 16 years in business. And we've got those special passes for that drive-in comedy. That's going to be a great night of relief for all of us. So take advantage of that at myhoustonmagic.com. Doc, you back?
I'm back. That was Comcastic.
Yeah. As good as it is what it is. So it's all good.
That's right.
Doc, have we? I forgot to mention. Make sure you take the survey to get the tickets. In our conversation today, did I miss anything that could be of use for our audience who checked in?
Well, I guess one thing that I want to mention that we didn't really, we did indirectly, but over the last 30 or so years, overall, we've seen a decline nationally in the incidence of colon cancer. That decline is mostly accounted for in individuals who are older than 50 who were doing the screenings as recommended. But in parallel with that, we've seen an increase in the number of cases of individuals younger than 50. And Chadwick Boseman is one example of that. And so there's a new designation called early age onset colorectal cancer. And that is now the reason why they've lowered the age to 45. Some think we ought to lower the age even further. Time will tell. The politics has something to do with that, I'm sure. But, I think I can tell you myself, I had my first colonoscopy at age 42. And that was before they were recommending doing it early. But if you have any symptoms, if you're seeing blood in your stool, you're losing weight for no reason, you're having unexplainable abdominal pain, you need to get that looked at. And it doesn't automatically mean you're having colon cancer, but I know right now we're dealing with COVID. A lot of us are stressed, and we want to first blame everything on stress, but other things like colon cancer has not taken the day off since COVID, right? So COVID and these other things are still ongoing. We've lost about a little over 200,000 people due to COVID. Every year we lose about 50,000 people to colon cancer. That's a lot. And about 150,000 develop colon cancer every year in the U.S. alone.
Yeah, it's the pandemic is a headline, but everything else underneath is still
That's right.
doing what it does, and
That's right.
we've got to make sure we get the word out. And let me make a correction on the survey, guys. It's for a chance to win the tickets, not take the survey and win. I get excited about these shows, so forgive me on the wording on that, but it's a survey for a chance to win. It passes for the comedy show. So, Doc, you're an asset to the community, sir. You are an asset, and I've enjoyed my time speaking with you today and encouraging folk to do as I did. And I took my colonoscopy late, but thank God I didn't have any polyps, and now it's a regular regimen of what I need to do. But it did help me in another area in my health and wellness. So in moderation, I would say, in terms of the diet, the exercise, the workout, but you need to schedule in that time a time to see Dr. Kevin Marks and have your colonoscopy or have your exam done. You know, like I tell the brothers with prostate cancer, yeah, the best way to find out is through the rectal exam, and doesn't mean anything other than your prostate is good. That's all that means. Yeah. So we're about saving lives, man. We're about saving lives and informing folk to make intelligent decisions, and finding doctors like yourself who provide great service to a number of people who may not have known you even existed.
That's correct.
All right, guys. Well, we're going to wrap it up on this. And again, take the survey for a chance to win the tickets to, we'll go again, the radio in me. Just fill out the survey for a chance to win. That's where I'm getting to. And go to myhoustonmagic.com. Doc, plans for this afternoon?
I got patients to see. Got to get back to work.
All right.
And as we said, illness doesn't take the day off, so we got to keep stamping it out. You know, I thank you for taking time out of your day to meet with me on this and letting me speak to your audience. And if there's anything for anyone out there that I can do to assist, or if you just need guidance, give our office a call. We'll be happy to help out. Whether it's with me or if you have an already established gastroenterologist, be sure, get yourself tested. Encourage your family members, the people you love, to get tested. And let's just keep tackling this beast every day, one by one.
Yeah, the process is painless. It's amazing how easy it is to go through. And when I came out of the colonoscopy, I had some of the best sleep ever. I felt great. You know, I don't know what it was they used to put us under there, but it was good. It was good. Well, God bless you, man. God bless your practice, and thank you for what you do. We do appreciate you.
I appreciate it. Thank you, Larry.
All right, sir. To the Facebook family, we'll see you this afternoon at 2. Have a great afternoon.
Wakanda forever.
Wakanda forever.